YouTube channel. Today we'll be discussing another very interesting topic of public health concern, and it's no other than postpartum depression, the silent struggle no one talks about. Just imagine holding your newborn in your arms, but instead of joy, you feel an overwhelming sadness, exhaustion, and even guilt. You are supposed to be happy, right? That you are now a mother, or if you've had other children, that you have a newborn baby added to the family. But instead of feeling happy, you are feeling anxious, you are terribly sad, and feels like something has gone wrong. If this sounds familiar, you are not alone, because postpartum depression affects 1 in 7 mothers, yet many suffer in silence and afraid of being judged. So today, we are going to break this silence, and that is why we are talking about postpartum depression. So in this presentation, we'll be uncovering what postpartum depression really is. Why does it happen? The warning signs you shouldn't ignore. How to find help. And most importantly, how to prevent and overcome postpartum depression. This conversation could save a life, so please stay with me till the end. I hope we all know too that postpartum depression can affect a young mother or an old mother, first-time moms or even experienced moms. Even fathers can experience postpartum depression. So as a way of introduction, we'll say that postpartum depression is a severe form of depression that occurs after childbirth, typically within the first few weeks to months. It's not just baby blues, which usually last a few days. It's a deeper emotional struggle that can affect your ability to care for yourself and your newborn baby. As bringing a baby into the world is supposed to be a joyful experience, but for many mothers, it can feel isolating and overwhelming. Let's take an example. Sarah, a first-time mom who had always dreamed of being a mother, but after giving birth, she found herself crying constantly, feeling anxious, even regretting becoming a mother. She thought she was just tired, but weeks passed and things didn't get better. This wasn't her fault. It was postpartum depression. She struggled to bond with her newborn and thought something was wrong with her, as she was constantly feeling exhausted, and at the verge, always crying and feeling unhappy, even though she loved her baby. If you or anyone you know has felt like this, keep listening. There is hope. So we move over to why postpartum depression happens, or in simpler terms, what are the likely causes of postpartum depression? Postpartum depression isn't a sign of weakness. It happens due to a combination of biological, emotional, and social factors, some of which we will discuss immediately. Number one on the list is hormonal changes. After birth, childbirth, estrogen, these are hormones, and progesterone, the levels drop drastically. This can affect moods and emotions, as happens to a lot of women who have postpartum depression. Lack of sleep and exhaustion is a second cause of postpartum depression. Caring for a newborn is demanding, leaving mothers physically and emotionally drained. It's not an easy time in a woman's life. So because she's not having enough sleep and she's exhausted, some of them go into postpartum depression. The third cause is history of depression or anxiety. If such a woman already has a history of depression or is being managed for depression or anxiety or any mental health issue, she is at risk of postpartum depression. So she may be more vulnerable. So we also talk about lack of support. Maybe the husband or relatives are not around, there's no help. This can also make a woman go into postpartum depression. That feeling of being alone or unsupported can increase stress and worsen depression. If the woman has also had a traumatic childbirth, that can also be a very important cause of postpartum depression, as a difficult delivery can leave a lasting emotional impact on the mother. Important for us to note is that we have said it can happen to any mother, whether a young mother or an old one, a first-time mother or an experienced mother. So what are the signs you shouldn't ignore? How do you know that how do you know if it's just baby blues or something more serious? And that is postpartum depression. Baby blues last about 2 weeks, but postpartum depression lasts longer than 2 weeks. It feels heavier and interferes with the person's daily life. What are some symptoms of postpartum depression? The person in question will be persistently sad. So there will be persistent sadness, hopelessness, emptiness, extreme fatigue, but difficulty sleeping. Even when very tired, exhausted, you can't sleep. Feeling disconnected from your baby. Severe anxiety. Panic attacks. Mood swings. Loss of interest in things you once enjoyed. Difficulty concentrating or making decisions. Thoughts of harming yourself or your baby in very severe cases. Another example we'll give in this presentation is a lady who adored her newborn baby, but she kept having intrusive thoughts that she wasn't a good mother. She feared she was falling and felt so guilty for even feeling this. So she felt she was actually failing as a mother and was also feeling guilty that she was failing as a mother. So she suffered in silence as she was afraid of being judged. But postpartum depression is not a sign of weakness. It is a medical condition that needs treatment and support urgently. So how can postpartum depression be managed? Postpartum depression can be treated. We must all know that. As many women recover completely with the right help. First of all, you must talk about it. As a woman, even as a man going through postpartum depression, or you are depressed or sad because of the overwhelming difficulty after the delivery, talk about it. You can talk about it with your friends, with family, or even better still, a doctor, a therapist, a nurse. This first step will help in healing. Tell your partner, tell your husband, tell your wife how you are feeling. You don't have to carry the burden alone. So the first step in managing postpartum depression is talking about it. You must talk. That is how people will get to know that this is what is going on with you and can help you or direct you to somewhere or someone you can get help from. The second step is seeking professional help. That is counseling, therapy. Go for therapy. You go and see a psychologist, a therapist to help you manage your emotions and develop coping strategies. You can be placed on medications by this same therapist, or if you are directed to meet doctors, they will prescribe safe antidepressants that won't harm breastfeeding, if that is what you are afraid of. So you must seek professional help as quickly as possible. After you have talked about it to your partner or whoever you choose to, you must go ahead, take a second step of seeking professional help. The third step, I beg your pardon, is self-care. When they say self-care is not selfish, it is real. You should be able to have time for yourself. Take a deep breath and look inwards. What are those things that usually make you happy? Is it watching movies? Is it listening to music? Is it eating certain meals, nutritious meals? You go back to getting them. as a healthy diet too helps balance mood and energy levels. If you're the type that likes taking juice, you like taking smoothies, you like taking certain things that make you happy, soft drinks, wine, just to mention but a few, you can go ahead and buy these things and keep them at home, as it's also a time of rejoicing and celebration of the arrival of the newborn. So you take this in a cautious manner and moderately, and you feel happy if those are some of the things that make you happy. Also, rest whenever you can. Find time to rest. Find time to rest. Find time to rest, as lack of sleep makes depression even worse. Exercise when possible. Even going on short walks outside can boost your mood and reduce stress. So try to go on short walks, sometimes with your partner or with anyone you deem fit, or even by yourself, as this can boost your mood and reduce stress. Because when you go for exercise, happy hormones are released, and this can also help you in managing any form of depression. Take breaks. Ask for help. Stay away when needed. You don't have to do it all alone. Sometimes you can hand the baby over to your spouse, or if you have a help at home, or even your mother or anybody that is around. It can be if you have some good neighbors that can also support you. Other mothers around can also support you. Just open up to people, and I believe, especially opening up to the right persons, I'm sure that you would have support as needed. The fourth way of managing postpartum depression is to find a support system. You can join a mom support group if you are finding certain things overwhelming. You have questions on your mind. You don't know how to manage your baby who is having one health challenge or the other in the first few weeks of being born. You personally may be having your own struggles. There are mom support groups where you can connect with other mothers facing similar struggles. This will reduce isolation and also postpartum depression. Ask for help. Let family or friends assist you with household chores or even the baby care so you can rest. You don't have to do anything alone. You don't have to carry your burdens alone. There are always good people around to help you, so you feel better. The fifth step is that you must overcome guilt and shame. Don't feel like there's something wrong with you and that's why you are feeling the way you are feeling, or like you are a bad mom, or you are not a good person, or you didn't prepare adequately for the postpartum for the postpartum period after delivery. No, you must overcome that. Try and believe in yourself again. You are able to carry this pregnancy up to 9 months, and believe in yourself that you will be able to go through the new phase of your life. You are now a mother, being also a wife, and all of that. You can manage it. You can go through it. You are doing well already so far. So this will not be a hindrance. So many mothers feel guilty for struggling. You don't have to feel like that. Remember, your mental health matters a lot. Getting help makes you strong, not weak. Your baby needs a happy mother, a healthy mother. So you must always have that in mind. So the earlier example we gave, so that particular mother finally reached out to a doctor and she started therapy and accepted help from family and from friends. Over time, she felt lighter, happier, stronger, and more connected with her baby. Recovery takes time though, but it is possible. Postpartum depression can be prevented. As a lot of you may have on your mind, if it's possible for postpartum depression to be prevented, the answer is yes. While postpartum depression can't always be avoided, you can reduce your risk. First of all, by preparing before delivery. That is why in our hospital we always ask patients, what is your plan for delivery? Who will come to take care of you? What plan, what support system do you have on ground or are you planning to have? As this is a very important time to prepare for the delivery so that situations like this will not arise. So discuss concerns with your doctor and build a support system, as nobody is an island. You have to prepare before birth. If you're still pregnant, listening to me now, very good, a good time. If you have not yet thought of it, what your plan is for delivery, please put that into consideration and start making plans for who you want to come over to your house or who you will need support from during delivery. What plans do you have for as support system so that you will not risk going into postpartum depression? You must, as a mother, a father, set realistic expectations. Motherhood isn't a perfect time or is not perfect, and struggling is normal. So you must set realistic expectations. Don't try doing things beyond what you can. Just do things in moderation. Prioritize sleep and nutrition. That's taking care of yourself helps your emotional well-being, like we have said. Take good care of yourself, sleep as much as you want, and rest. Eat good food, watch movies, take care of yourself, and be happy that you have a newborn in the family. Ask for help early. Don't wait. If you start feeling down, seek support immediately. Don't delay. Seek support immediately. Don't wait, as this will help prevent a lot of other issues or complications as a result of postpartum depression. So we believe we have helped to break the silence of postpartum depression, because postpartum depression is real, but so is recovery. If you are struggling, please remember you are not alone. You are not a bad mother as well. You deserve help. So please, if this video helped you or could help someone you know, please share. Let's create a world where no mother suffers in silence. Do you want me to cover more topics like this, let me know in the comment section. And don't forget to like, share, and subscribe to help spread awareness. You are not alone, and you will get through this. So, thank you very much for listening. I hope you have been touched and you'll be able to help someone who also is going through this at the moment. Thank you very much.